And welcome to the Florida Agricultural Mechanical University Medical Marijuana Education and Research Initiative Basic Education course. My name is Dr. Patricia Green Powell, and I serve as the Interim Executive Director for the Florida A&M University Medical Marijuana Education and Research Initiative. I want to thank you for participating in this basic education course. The Florida Legislature charged Florida A&M University to educate minorities about marijuana for medical use and the impact of the unlawful use of marijuana on minority communities. FAMU responded by establishing the Medical Marijuana Education and Research Initiative, fondly known as MMERI, M-M-E-R-I. The information in this course is general. This is not legal or medical advice. For such assistance, please contact your attorney or your health care provider. In this course, we will cover definitions, the history of marijuana, criminalization, Florida law, authorization, medical marijuana, safety issues, access, medical marijuana and qualifying conditions, and qualified physicians, unlawful sale and use, and self-care and prevention strategies. While there are several terms and definitions associated with medical marijuana and marijuana, for purposes of this basic course, the terms listed on your screen will be discussed in this presentation. Here's a picture of what a marijuana plant looks like. It is important to know a bit of history of marijuana, and this is the earliest evidence. The use of medical marijuana is almost as old as the system itself, having been documented for over 1,800 years. It was famously used by the emperor and pharmacologist Shen Nung. First name spelled S-H-E-N, last name N-U-N-G. Nung wrote about this herb in a book on treatment methods that he penned way back in 2727 BC. He described it as an elixir, apparently created from the leaves of cannabis flowers. There is also history about the mummy of a woman from the 5th century BC, the Siberian Ice Maiden. It was discovered that the Ice Maiden suffered from breast cancer. She used cannabis to cope with her devastating illness. It is known from the research that in her burial chamber was a container of cannabis. Here's what the site dig looked like, and a picture of her mummified remains. Criminalization. How did we get from medicinal to criminal? Marijuana, also known by other street names such as pot, weed, grass, and others, has a long history of human use. Most ancient cultures didn't grow the plant to get high, but as herbal medicine. By the late 1800s, cannabis extracts were sold in pharmacies and doctors' offices throughout Europe and the United States to treat stomach problems and other ailments. Scientists later discovered that THC was the source of marijuana's medicinal properties. The war on drugs and unequal outcomes. The war on drugs is a phrase used to refer to a government-led initiative that aims to stop illegal drug use, distribution, and trade by dramatically increasing prison sentences for both drug dealers and users. The movement started in the 1970s and is still evolving today. Over the years, people have had mixed reactions to the campaign, ranging from full support to claims that it has racist and political objectives. As part of the war on drugs, the Controlled Substance Act of 1970 was signed into law, repealed the Marijuana Tax Act, and listed marijuana as a Schedule I drug. There are more arrests for recreational marijuana possession every year than all violent crimes combined. The arrest creates a permanent criminal record that can easily be found on the internet by employers, landlords, and representatives from housing authorities and schools and credit unions and, of course, banks. The war on drugs has produced profoundly unequal outcomes across racial groups that's manifested through racial discrimination by law enforcement and a disproportionate drug war misery that's suffered by communities of color. Marijuana, why now? Marijuana's role in the healthcare universe has grown significantly over the past few years. Currently, approximately 33 states have legalized the use of medical marijuana, and more states are considering making it legal for recreational purposes as well. The chronology of events seen on your screen led to why we're having this conversation about medical marijuana. What is the law in Florida? Section 381.986 Florida statutes allows for the use of medical marijuana and low THC cannabis by qualified patients as certified by a qualified physician. The statute details the duties of the Office of Medical Marijuana Use, which is OMMU, within Florida's Department of Health. Medical marijuana is legal in Florida. Recreational is not. To get additional information, log in to knowthefacts.mmj.com. What is lawful? Qualified patients can use medical marijuana at home on private property. Medical marijuana is not to be shared. It is available in Florida and remains illegal according to the federal government. Medical marijuana may only be purchased at a licensed medical marijuana treatment center, also known as MMTC. This is either at a dispensing location or via delivery. Medical marijuana treatment centers are the only entities that's legally allowed to dispense medical marijuana in the state of Florida. Here's what a picture of a medical marijuana treatment center may look like. So what is unlawful in Florida? Even though medical marijuana is legal in Florida, it is still classified as a Schedule I substance by the federal government. Given its Schedule I status, possession of marijuana is still federally illegal. Although many states have joined Florida in legalizing medical marijuana, federal law supersedes any law that state government would have in place. In Florida, possession of less than 20 grams of marijuana is a misdemeanor offense, carrying a penalty of up to 1 year of incarceration and a fine of up to $1,000. Possession of more than 20 grams is considered a felony, which can result in 5 years of imprisonment and a fine not to exceed $5,000. Although the federal government hasn't given its approval to marijuana for medical use, it has approved 3 related compounds are specific treatments. If you have nausea caused by chemotherapy, you may take a synthetic cannabinoid, either dronabinol or Nabil-1. Dronabinol also can boost appetite for people with AIDS. The FDA has approved epidoctal as a treatment for 2 rare kinds of epilepsy. Cannabis plants containing more than 0.3% of the psychoactive cannabinoid THC are considered medical marijuana. Currently, the 2 main cannabinoids from the marijuana plant are THC and CBD. THC can increase appetite and reduce nausea, may also decrease pain, inflammation, and muscle control problems. CBD, also sold in medical marijuana treatment centers, is a cannabinoid that doesn't make people high, may be useful in reducing pain and inflammation and controlling epileptic seizures. Cannabinoid receptors are present throughout the body. They're embedded in cell membranes and are believed to be more numerous than any other receptor system. When marijuana is smoked, its active ingredient, THC, travels throughout the body, including the brain, to produce its many effects. THC attaches to sites called cannabinoid receptors or nerves in the brain, affecting the way those cells work. Cannabinoid receptors are abundant in parts of the brain that regulate movement, coordination, learning, and memory, higher cognitive functions such as judgment and pleasure. If you look at the picture, the basal ganglia is the area that controls speech. The hippocampus regulates motivation, emotion, learning, memory, movement, and posture. The cerebellum coordinates volunteer movements such as posture, balance, coordination, and speech. Here's what those brain centers and functions look like that I just described. So what we don't know, although marijuana has been an herbal remedy for centuries, the evidence, the research for how well it works is lacking in some cases. Scientists prefer large studies and certain types of controls before they draw conclusions. And so what we don't know is because sufficient research has not been done either in longitudinal or long-term studies. And we know that the federal level it's still considered a Schedule I controlled substance, and there's fear among entities of losing federal funds. Safety issues. Methods of administration can be found in Section 381.986 of Florida statutes. Florida law allows a qualified physician to determine smoking medical marijuana as an appropriate means of application. To avoid inhaling the smoke, some use vaporizers. Devices pull the active ingredient and collects the vapor for inhalation and not the smoke. Medical marijuana mixed in foods is not legal in the state of Florida. And of course there are many forms of administration, from capsules to creams to suppositories. The physician may recommend CBD alone, being purchased from a dispensary, or THC alone, or a physician may recommend a combination or a hybrid, what is known as a 1-to-1 ratio. Here's what a picture of the medical marijuana forms and devices may look like. Access. A qualified patient must be a permanent or seasonal Florida resident, diagnosed with a qualifying condition by a qualified physician, and of course to obtain a medical marijuana use registry identification card for the cost of $75. Florida's medical marijuana laws allows the use of medical marijuana and low THC cannabis by patients under the age of 18, as recommended by the patient's qualified physician. However, marijuana use in adolescence can have potentially harmful and long-lasting effects on a teen's health and well-being. It is important for minors and their caregivers to be aware of the possible health effects in order to make a well-informed decision about whether medical marijuana is right for them or their loved one. The source for this information is at the Florida Department of Health. Know the facts, health effects on minors. Here's the address, know the facts, mmj.com, or you can go to our own Florida A&M University Medical Marijuana Education Research Initiative at mmeri.famu.edu. When you're on our website, visit our repository where you will find additional information. Here's a list of the qualifying conditions. You and your doctor. The relationship and follow-up between patient and doctor are so very important. And if you have a medical condition that qualifies you for a medical marijuana use card in the state of Florida, this relationship becomes absolutely the need for being open and honest with your physician. The physician would need to know what vitamins or other medicines that you are taking. The physician would need to want you to know that medical marijuana is regulated by the state, and medical marijuana products purchased in a medical marijuana treatment center are safe. The CBDs that bought in stores and gas stations are not yet regulated, and of course the content cannot be guaranteed. According to the Florida Department of Health, it is the responsibility of a qualified physician to follow Florida law, diagnose patients, and determine if medical marijuana is an appropriate treatment. To acquire additional information regarding qualified physicians, visit the link on your screen. Know the facts, mmj.com/physicians. Additionally, in this PowerPoint, this presentation, there is a link where you can get a directory of the qualified physicians in the state of Florida. Unlawful sale and manufacture of marijuana in the state of Florida. Marijuana possession is a crime in Florida. The potential penalties depend on the amount possessed, as well as where they're sold, the amount manufactured or sold, where the crime is committed. And you can see the statute where that information came from. Unlawful marijuana use and your health. Marijuana use directly affects the brain, specifically the parts of the brain, as we learned earlier, responsible for memory and learning and attention, decision-making, reaction time. Smoke from marijuana contains many of the same toxins and irritants as tobacco smoke, which are harmful to your lungs and cardiovascular system. Using marijuana makes your heart beat faster. It can also lead to increased risk of stroke or heart disease. Smoking marijuana can also lead to a greater risk of bronchitis, cough, and phlegm. Unlawful marijuana use and mental illness. Marijuana is a mind-altering compound that affect both your brain and your body. It can be addictive, and it may be harmful to your health. A 2017 study in the American Journal of Psychiatry found that nearly half of 6,788 patients who experienced marijuana-induced psychosis went on to develop schizophrenia or bipolar disorder. Not everyone's experience with marijuana is pleasant. It often can leave you anxious, afraid, and panicked. Using recreational marijuana may raise your chances of clinical depression or worsen the symptoms of any mental disorders you may already have. Scientists aren't yet sure exactly why. In high doses, it can make you paranoid and lose touch with reality, so you oftentimes will hear and see things that aren't there. Prevention, self-care, and resources. Avoid using the drug unless a medical professional prescribes it to you. Marijuana possession is a crime in Florida. The potential penalties depend on the amount possessed, as we said earlier. It is important to know that about 1 in 10 people who use recreational marijuana may become addicted. That means you can't stop using it even if it harms your relationships, job, health, or finances. The risk is greater the younger you start marijuana and the more heavily you use it. Prevention, self-care, and resources. Surrounding yourself with supportive family and friends who you can trust is vitally important. Learn coping skills on how to manage your stress. It is also beneficial to get plenty of exercise and eat a healthy, well-balanced diet. Section 408.918 Florida Statutes authorizes the implementation of a statewide Florida 211 network as a free and confidential referral help. The Substance Abuse and Mental Health Services Administration's National Drug and Alcohol Treatment Referral Service provides free and confidential information in both English and Spanish, 24 hours a day, 7 days a week. The number is on your screen. This is available for individuals and families facing substance abuse and mental health issues. In summary, in this basic course, we have covered history, criminalization, lawful and unlawful uses, medical marijuana for certain medical conditions, how to get medical marijuana for qualified conditions and from qualified physicians, the consequences of unlawful use of marijuana, mental illness, and prevention and self-care strategies. I want to thank you for your participation in this basic education course, and we appreciate your feedback. We are eternally grateful to the Florida Legislature, the Executive Office of the Governor, the Florida Cabinet, the Florida Judiciary, FAMU's Board of Trustees, FAMU's President and Leadership Team, our wonderful and outstanding faculty, staff, and students, and, of course, a Medical Marijuana Education Research Initiative External Advisory Council, and our very supportive FAMU alumni of what they do for the FAMU Medical Marijuana Education Research Initiative for MMERI and its benefits to the state of Florida. Many thanks to the Florida Department of Health's OMMU office, Florida's law enforcement organizations, and other public and private sector stakeholders for the support and how you have embraced MMERI during this time as we spread the word in cities, counties, and minority communities all across this great state of Florida. Remember to contact the MMERI team via email, phone, or by visiting our website. That information is on the screen. Thank you once again for joining this basic course.